In the medical office, medication is most commonly administered parenterally. Parenteral refers to the administration of medication by injection and includes the following routes: intramuscular, subcutaneous, and intradermal. An important responsibility of the medical assistant is to administer parenteral medication. The medical assistant must administer medication only under the direction of the physician. Before administering medication to a patient, be sure to carefully review the package insert accompanying the medication. You must be completely familiar with the indications, adverse reactions, route of administration, dosage range, and storage requirements of each medication you administer. In the medical office, an injection is often prepared from a vial or an ampule. The medical assistant will show you how to prepare an injection from both a vial and an ampule, starting with a vial. A vial is a closed glass container with a rubber stopper. An injectable medication may be available in a single-dose vial or a multiple-dose vial. To prepare an injection for administration from a vial, begin by sanitizing your hands. Assemble the equipment. You will need the appropriate syringe and needle for the type of injection to be administered and an antiseptic wipe. Work in a quiet and well-lit atmosphere. Good lighting helps you read the medication label. During this procedure, you must check the drug label 3 times to make sure you have the correct medication. Select the proper medication from its storage location. Check the drug label and compare the medication with the physician's instructions. Check the expiration date. An outdated medication should not be used because it could produce undesirable effects. Open the syringe and needle package. Check to ensure that the needle is attached firmly to the syringe. Do this by grasping the needle at the hub and tightening it. Break the seal on the syringe by moving the plunger back and forth several times. Check the drug label a second time to ensure it is the correct medication. If the medication requires mixing, roll the vial between your hands to obtain a uniform suspension of the medication. If the vial is new and has not been previously opened, remove the plastic or metal cap protecting the rubber stopper of the vial. Open the antiseptic wipe and cleanse the rubber stopper of the vial. This removes any dust or bacteria present on the stopper. You are now ready to withdraw the medication from the vial. Place the vial in an upright position on a flat surface. Remove the needle guard. Pull back the plunger to draw an amount of air into the syringe equal to the amount of medication to be withdrawn from the vial. Using moderate pressure, insert the needle through the center of the rubber stopper at a 90-degree angle until it reaches the empty space between the stopper and fluid level. Be careful not to bend the needle. Push down on the plunger to inject air into the vial. Injecting air into the vial prevents the formation of a vacuum, which would make it difficult to withdraw medication. Make sure to keep the needle opening above the fluid level to avoid creating air bubbles in the medication. Invert the vial while holding onto the syringe and plunger. Keep the needle opening below the fluid level to prevent drawing air into the syringe. Hold the syringe at eye level and withdraw the proper amount of medication into the syringe. Remove any air bubbles in the syringe by holding the syringe in a vertical position and tapping the barrel with the fingertips until they disappear. Air bubbles take up space the medication should occupy, which prevents the patient from getting the proper dose of medication. Remove any air remaining at the top of the syringe by slowly pushing the plunger forward and allowing the air to flow back into the vial. Carefully remove the needle from the rubber stopper and replace the needle guard. The needle guard prevents the sterile needle from becoming contaminated. Check the drug label for the 3rd time and return the medication to its proper storage location. The medical assistant will now show you how to prepare an injection from an ampule. An ampule is a small sealed glass container that holds a single dose of medication. A filter needle must be used when withdrawing medication from an ampule. The filter needle prevents glass particles from the broken ampule from being withdrawn into the syringe. First, remove the regular needle from the syringe. Next, attach a filter needle. Open an antiseptic wipe and cleanse the neck of the ampule to remove any dust and bacteria. Tap the stem of the ampule lightly to remove any medication in the neck of the ampule. Place a piece of gauze around the neck of the ampule. Hold the base of the ampule between the first 2 fingers and thumb of one hand. Hold the neck of the vial between 2 fingers and the thumb of the other hand. Apply a strong, steady pressure with the thumbs and break off the stem by snapping it quickly and firmly away from the body. Discard the stem and gauze in a biohazard sharps container. You are now ready to withdraw the medication from the ampule. Place the ampule on a flat surface. Remove the needle guard and insert the filter needle into the ampule. Keep the needle opening below the fluid level to avoid drawing air into the syringe. Withdraw the proper amount of medication into the syringe by pulling back on the plunger. Tilt the ampule as needed to keep the needle opening immersed in the fluid. The medical assistant will show you a second method for withdrawing medication from an ampule. Choose the technique that is easiest for you. Invert the ampule so that it is upside down. Insert the needle into the ampule, making sure to keep the needle opening below the fluid level. Withdraw the proper amount of medication by pulling back on the plunger. Move the needle downwards as necessary to keep the needle opening immersed in the fluid. After withdrawing the proper amount of medication into your syringe, remove the needle from the ampule and replace the needle guard. Dispose of the ampule in a biohazard sharps container. Remove the filter needle and guard from the syringe and discard them in a biohazard sharps container. Reapply the regular needle and guard to the syringe. If air bubbles are in the syringe, hold the syringe in a vertical position and tap the barrel with the fingertips until they disappear. Remove the air at the top of the syringe by removing the needle guard and slowly pushing the plunger forward. Replace the needle guard. Once you have prepared the injection, you are ready to administer the medication to the patient. Place the needle and syringe on a tray with an antiseptic wipe, a gauze pad, and an adhesive bandage. Take it to the patient's room along with the patient's chart. You will learn how to administer injections on other videos included in this chapter.